Patients who are wondering how many low-tech treatments they should attempt before moving on to IVF, and most doctors think that IUI, or intrauterine insemination with gonadotropin support, should be attempted maybe no more than 3 times before moving on to IVF. And most women, although not all, but many, if they're going to conceive through IUI, will do so within 3 attempts before moving on to IVF. And a lot of women wonder about this, but if they move on to IVF, sometimes they get a faster result and at the same time more cost-effective than if they just stay with too many IUIs. So sometimes IVF is the best route in the long run. There are a number of psychological roadblocks that would prevent a patient from moving on to IVF. There are a number of concerns and fears, and women sometimes don't know exactly where to proceed or how to get through those roadblocks. I'm speaking today with Linda, one of my former clients, about talking about moving into IVF and different treatments. Do you sometimes feel like you're kind of at a crossroads and you're not sure which way that you're going to go from here?
Yes, I'm scared. I don't know. We've had so many disappointments, and I just don't know if the next thing is what it's going to bring, if it will ultimately bring a baby, which is obviously our wish, or just more disappointment. There's several things that I'm concerned about moving forward.
Well, the stress and anxiety is very real, and it is a very normal reaction to the sort of decision point that you're at right now. That feeling of being at a crossroads, that feeling of having to make a decision, and the feeling of maybe time is ticking on and running out, and you feel like you have to do something, you have to make a decision. But there are so many decisions to be made. And sometimes women become very loyal to a doctor who does a lot of low-tech treatments like intrauterine insemination, and they don't really do IVF that often. So some women may find that they're not being encouraged to consider IVF, which actually could be a better treatment in the long run for them.
Fortunately, our doctor has encouraged us to move on to another practice that does do IVFs. It's hard to leave the doctor that I've been with. He's been so great, and we trust him completely, but I do appreciate that he has encouraged us to move on, and I feel like he's given us a name of someone who's going to treat us well, and I feel like we'll be in good hands. The best thing is that he's given us hope. I mean, we're continuing to try, and we're very hopeful no matter how we get our family, whether it's through IVF or adoption or what we ultimately decide, but we are hopeful.
One of the things I might suggest, Linda, is to really learn about what IVF is all about. Go to a class, watch a video, ask your doctor to help you really understand what IVF is all about. Demystify it so that it becomes something that you're not fearful of, so there's no real surprises once you get into treatment. Have you noticed that sometimes your stress level begins to rise and you're having some anxiety about this?
Absolutely. Always right before my cycle, always right before we're about to start treatment or try again, whatever, I am very, very nervous. My anxiety is through the roof, as is my husband's. It's just a very exhausting and stressful time.
This is a time in your life that you probably never expected to be participating in. You probably never thought, I would be in this position of not being able to get pregnant. That in itself really brings out a huge amount of anxiety, and then for some women even high levels of depression. This is a very common response, and women are sometimes surprised by how intense their feelings are about not being able to conceive. So we have learned that relaxation techniques are very helpful here. Many experts now believe, and women believe from their own bodies, that their body and mind are connected, and that extremely high levels of stress can interfere with the body's natural ability to conceive. So learning to truly relax is a really important part of this. It doesn't guarantee pregnancy, but it certainly can make being a participant in this process of fertility treatments a much easier way to handle. Some of those things could be finding a mind-body practitioner, yoga, guided imagery, learning some breathing techniques, learning to be really calm and still so that you feel like you're way more in control of this process than you felt at the beginning of it. no matter whether your treatment is a success or maybe not a success and you need to move to some other options. Learning to be stress-free, learning to manage your anxiety is a really important part of this. For a lot of couples, it makes a big difference if you have some sort of a game plan about where your treatment is going to go, such as, well, maybe I'll do one more IUI and then I'll think about IVF, or then I'll think about adoption or some other option. Have you thought about creating a game plan for yourself so you kind of have a roadmap of where you're going?
I would say we have a loose roadmap. We definitely talk about, if it doesn't happen this time, what are we going to do next time? That we made an agreement that nothing is set in stone. It's scary to think that, if this doesn't happen, then this is what we have to do, or this is the end of the road, or whatever. But we certainly do have sort of a game plan as to how we think we would like to proceed in the future. And I do find that that's helpful. The unknown is not so completely unknown.
For women who don't get pregnant with IUI, sometimes moving ahead with IVF may produce a speedier result and may be more cost effective in the long run rather than doing IUI over and over.